I'm Dr. Christopher Failing. I'm a pediatric rheumatologist at Essentia Health. So pediatric rheumatologists are specialists who see children for autoimmune or inflammatory conditions involving muscles, bones or connective tissue and joints. A child or a young adult would come to see me for most commonly evaluation of joint pain with concern for juvenile idiopathic arthritis. And it's fairly common. It affects around 1 out of 1,000 children, so it's more common than juvenile diabetes. I also see children for a variety of other underlying rheumatologic diseases, including Sjogren's syndrome, mixed connective tissue disease, systemic lupus erythematosus. We also see kids a lot for evaluations for periodic fever syndromes, which may present with recurrent, unexplained, or prolonged fevers. It's the first time I see them, I really want to get to know them as a person and their family, get to know their interests, their hobbies, before I really kind of dive into what brings them to see me, because they're a person first with an underlying medical condition, not a person with a medical condition. The younger kids, I really try to make games out of the visit and try to get them laugh and feel as comfortable as they possibly can. The team of people I work with is a multidisciplinary approach. So we have a team of nurses in our clinic who have experience in treating patients with rheumatologic diseases. They provide additional education on the medications and the disorders to the patients. I also work very closely with the child's primary care provider, who plays a vital role in the treatment team. Physical therapists also play a big role, so I'm frequently in communication with them, as well as other subspecialists that might be involved, including ophthalmologists, as kids with some rheumatologic diseases have inflammatory eye disease. And lastly, the parent plays one of the most important roles of the team, so we really need to get them involved in the child's care and to be an advocate for their health. I think I positively impact their life by really providing education on their disease and getting them to have a really good understanding of it. I also really strive to form long-term partnerships between the patient and their family, which I think is extremely important, and which makes it a very rewarding aspect of my job as well. The most fulfilling about my work is, just peds rheumatology in general is extremely rewarding, as a majority of our conditions we can treat. So it's extremely rewarding to have a child who initially comes to us. They may have significant disability with their arthritis or functional limitations, and after a few months of treatment, they're kind of back to being a normal kid, playing sports, doing the things that they enjoy, and I can't think of anything that's more rewarding than that.